Yeah, hello and welcome to Fact Files from the front lines as we continue our conversations with doctors who are treating patients and at the front lines of the battle against coronavirus. I'm joined now by Jeenam Shah, consultant chest physician and interventional pulmonologist at the Saifee, Wockhardt and Bhatia Hospitals in Mumbai. So before I come to him, just a quick background now. Mumbai is standing at about 490 cases plus. And the overall India tally is over 4,000. It's about 4,067 cases and 109 deaths. Maharashtra has 781 cases and is the largest in the country, followed by Tamil Nadu, followed by Delhi. So as cities go, if you take Delhi as a city and Mumbai, then they're pretty much neck to neck at and being the largest metro epicenters of the COVID virus in the country. So, Dr. Shah, thank you very much for joining us. Now, I know that you are attached to the Wockhardt Hospital, but you're not able to go back in because you've been, in a way, locked out because there was a spread in the hospital itself, and some 26 nurses and 3 doctors were tested positive. So,
Yes.
till that point, you were treating patients. So, tell us about what the current situation is and so on.
First of all, I'd like to thank inviting me at the show. So, yes, I'm treating patients in Wockhardt Hospital as well as Saifee Hospital. Both those hospitals have COVID patients. When I was treating 2 separate sections for COVID patients and non-COVID patients. So, what happened was one patient unfortunately came in with some cardiac complaints. So, he had under and all those kind of procedures which are required for a cardiac. The patient was actually recovering from his condition, but post-recovery he developed fever, and that is the time that we tested him for a COVID infection and actually turned out to be positive.
Yeah.
So those kind of presentations are very rare for COVID to present directly as a cardiac complaint. But in those kind of situation, we never suspect. We generally suspect a COVID infection when you have a respiratory complaint. So unfortunately, in this patient, because we lost out on this 5 to 7 days period when he was actually infective, he actually ended up infecting a lot of nurse and a lot of healthcare workers around him. That is why we have many positive cases in Wockhardt, not necessarily having enough PPEs. The reason was something else only. So yeah, the Wockhardt Hospital is actually right now in a lockdown situation. No patients have been admitted now. But Saifee now has started taking admissions. Briefly, they had also been in a lockdown because one patient had come out to be positive in Saifee.
Yeah.
So briefly, it was under lockdown. Now again, Saifee has started working. As of now, Saifee Hospital has around 50 beds for COVID patients, and gradually they are filling it up. So that is the situation from the baseline as of now.
Right. So amongst the patients, and any rough number that you can give me of patients that you've seen at least till this point?
So till this point, confirmed positive, I've seen around 14 to 15.
Okay.
And rest of the patients were suspected. So if you count totally, in Saifee around 10 to 25 approximately, I've seen already in COVID.
Right. So amongst these patients that you've seen now, what are the common trends in terms of what you've observed? What are the symptoms? And also, I'm sure they're demographically they are diverse. So are the symptoms equally prevalent amongst all of them? Does it look different?
So yeah, so basically there's a difference between a community and there's a difference between a healthcare setting. So out of the 25 patients, if I see, I have a lot of patients in the healthcare setting itself because the nurses were exposed, the doctors were exposed. So we ended up testing them because they didn't have symptoms also, because it is something known as a contact tracing. So if a person comes out to be positive, anyone who's nearby that person, or suppose the sisters are handling those patients, we have to test them by default even though they don't have symptoms. So those turned out to be positive, but they were asymptomatic. But that may not be true in the general public. So if I say for 25 people I have managed, out of them around 10 people were the healthcare workers itself. So they were hardly symptomatic, or I would say asymptomatic completely.
Okay.
If I talk about the community again, the rough numbers are that around 80% of the people are almost not symptomatic or mildly symptomatic. So in my condition, out of the 25, almost 20 to 22 were asymptomatic. Only 3 patients we had were symptomatic. Out of them, we had 2 deaths, and one patient is actually recovering, even though she had been critical in between. But she has been recovering well, and I think in a couple of days we should be in a condition to discharge them.
Right. So those who passed away, what was the reason? I mean, I know it's coronavirus, but what precipitated their condition or?
So basically, two people who expired.
Mm-hmm.
One person was that cardiac patient that was an index case. He
Mm-hmm.
had complications related to cardiac problems as well as respiratory problems.
Mm.
Elderly gentleman with lot of comorbidity. So that is a typical picture that we have been seeing it in all the media channels.
Mm-hmm.
The second patient also had a respiratory complaint. Elderly gentleman more than 70 years old. So both these patients have been having those typical features of comorbidities, elderly age, and one
Mm-hmm.
person, one female who is again in her 70s, she's having a lung condition known as interstitial lung disease.
Mm-hmm.
But she developed a lot of hypoxia in between. She had a lot of high grade fever, but gradually she's coming out. Now she's completely asymptomatic, not having any fever. So I
Mm-hmm.
think she's on a way home in a couple of days.
And was she
The rest of the
on
patient,
a ventilator as well?
no, she was not on ventilator. She recovered just on oxygen supplementation. The
Okay.
other two patients were ventilated. Yes.
Right. So, I mean, I know one case is not enough to draw too many conclusions, but if there are any conclusions, what are they?
So conclusion regarding the outcome of the patients.
The one who recovered.
So not it is not just one who has recovered. We have actually discharged a lot of patients, but
Mm.
those patients were predominantly mildly symptomatic or asymptomatic. So we have already had around 15 discharges by now.
Mm-hmm.
15 patients who had an infection, had mild fever or no fever or some cough and some malaise. They have
Mm.
actually recovered and completely recovered and gone home.
Right.
So
No, so what I
conclusion
meant is the patient where, let's say, things progressed to a more serious level and then you were able to cure.
Yes, so this is only one case as of now we have that has progressed to a severe level. So I mean it's very difficult to conclude what is the reason that she recovered and what is the reason the other people
Mm.
didn't recover. But I think it all depends on the person's host factors. We
Mm-hmm.
cannot really predict. But yes, whoever patients have recovered, I'm talking about the healthcare workers. They were completely fit. They were all in their 20s or they are in their 30s
Mm-hmm.
who have had very mild symptoms. They didn't have any comorbidities like diabetes or any cardiac or lung issues. They have
Mm-hmm.
hardly had any symptoms and they have recovered wonderfully well. So yeah, it is going with the global trend that if you are young, if you are having very minimal comorbidities or no comorbidities, you are less likely to be having any serious infection. So going to the trend in India
Mm.
or in Maharashtra also, there are a lot of patients who have been infected are from the younger population.
Mm.
Probably because we have had a lockdown very at the primitive stages. So
Mm.
probably the reason why most of the elderly people have been homebound, and
Yeah.
only people who are young have been going out for getting their essentials or any other food items or any other essential stuff. Probably they have been exposed because they have been going out and they are getting infected. That is
Right.
actually a good thing.
And what's the treatment path that you've been following and that's also working in your mind?
So treatment part is, I mean, every treatment right now and throughout the world is still investigational. We are not
Yeah.
sure. But
Mm.
what we are doing is, if we feel that the drug is safe enough to be given to a patient, we are giving it.
Mm-hmm.
We even though we don't have a lot of data behind it. So as of now, we have been giving hydroxychloroquine, we have been
Mm.
giving azithromycin, and we have been giving multivitamins just
Mm-hmm.
to boost up the immunity. Apart
Mm.
from that, any symptomatic treatment if required, that is, if the patient has fever, we are giving paracetamol. If the patient has low oxygen levels, we are giving oxygen supplementation and ventilator support and SOS. So that
Mm.
is the treatment protocol that we are following, and I think that is the standard everywhere across India.
Right. So, I mean, as a specialist and pulmonologist, I mean, are you seeing any conditions that are unique to maybe living in cities like Mumbai or maybe even Delhi, of course, which has even higher pollution, but which in some ways has a role or can play a role in the way the disease progresses?
So I would probably say there are two factors associated with it. All the urban areas which have had sudden spurge in cases is probably more or less related to the international travel. So most
Yeah.
of my patients who came in initially, they
Mm.
all come from either European countries or UK or USA. So initially, all the three patients I received were had a travel history.
Mm-hmm.
So probably we live in an urban area, so the people are more forward and they have more business ties up. So that
Mm.
is why they have been traveling more. And initially we got those kind of cases,
Mm-hmm.
but that was the initial number. But now it has got accentuated probably because of the living condition in urban areas. We have houses which are very much jam packed, and we have a lot of per kilometer density of people. So probably that is the thing that is accentuating. And the
Mm.
reason why we started off is probably because of the international travel. That is what I feel
Right.
as of
Okay.
now.
Right. But do you feel that a weak lung, if one can say so, is in itself maybe responsible for some people maybe getting worse, more affected than others?
Yes, absolutely. So it is a known condition. So cardiac conditions it tops the list. Whatever literature is there available, cardiac condition is the most risky condition to develop a COVID infection, followed by hypertension and diabetes and chronic lung diseases like ILDs and asthmas. Also, people are tending to fall ill sooner than any other person. It is
Right.
known factor. Yes.
Right. Okay. So, looking forward, Dr. Shah, what's your sense? I mean, is it from what you're seeing? Does it look like it's you're going to see more cases? And if so, then do you think we will be able to treat most of them? And essentially, and generally also, what are you telling people, and what are you advising people to do at this point?
So if you ask me personally, I feel the urban areas which are affected are going to have a longer run. I
Mm-hmm.
don't think so. It is going to end on 14th of April as the Prime Minister has declared.
Mm-hmm.
Probably at the end of 14th April, we might have some graded lockdowns. Cities or
Mm-hmm.
urban areas which are probably more affected would have again lockdown which has been imposed. That is my personal feeling because we do need to continue that. We have
Mm-hmm.
not seen such a huge spurge of cases. Probably the reason is the lockdown. So I
Mm-hmm.
think that would be continued. And talking about the advice to the general public, I feel that we have gone in the right direction, but the battle is not won as of now. I
Mm-hmm.
think we still need to continue whatever we have been doing diligently, social distancing, staying indoors, not venturing out, and anyone having symptoms, please get yourself tested or at least consult a doctor what to do next.
Okay. Right, Dr. Shah, thank you so much for joining us and sharing your thoughts, and wish you all the best in this battle against this virus. Thank you so much.
Thank you.